everyone. Welcome back to the Health Diagnostic Podcast. My name is Sophia.
And my name is Alana, and we are thrilled to have you joining us today for our first official episode.
Before we begin, please remember that we are not providing any medical advice. This podcast is used to spread awareness and should not be used as a diagnosis tool. Please consult your doctor before making any lifestyle changes.
Let's dive into today's topic. As you might know, May is Mental Health Awareness Month, so today we will be speaking about stress and anxiety and the different ways to manage it. According to the American Psychological Association, 1 in 5 adults experience symptoms of anxiety. This is an important statistic to remember because it serves as a reminder that this is common and completely normal to feel from time to time.
First, we're going to define what stress and anxiety are and how they differ. Stress is a direct response to an external threat or stressor. A stressor can be an upcoming deadline or a challenging situation. Stress usually fades and lessens when the stressor is removed. When we talk about anxiety, it is defined as a persistent feeling of worry when there is no apparent external threat. This can cause feelings of intense worry and fear in everyday situations and can impact each part of your life.
There are many different types of anxiety disorders, such as agoraphobia, generalized anxiety disorder, or GED, panic disorder, and social anxiety disorder. According to the Mayo Clinic, agoraphobia is a type of anxiety disorder where you avoid places or situations that may cause you to panic. People with this type of anxiety often feel helpless and embarrassed. GED is persistent and excessive worry about events that are part of your daily routine.
Panic disorder causes a person to have feelings of intense anxiety and fear. These types of episodes are commonly known as panic attacks and can cause physical symptoms such as shortness of breath, chest pain, or heart palpitations. Another common type of anxiety is social anxiety. According to the National Institute of Mental Health, an estimated 12% of U.S. adults experience social anxiety disorder at some time in their lives. As stated by the Mayo Clinic, social anxiety disorder causes high levels of anxiety, fear, and avoidance of social situations due to feelings of self-consciousness and concern about being judged negatively by the people around them.
Although there are many types of anxiety disorders, there are some symptoms that are consistently recognized in all kinds of anxiety. These symptoms include hyperventilation, trembling, sweating, feeling weak or tired, having trouble sleeping, having difficulty controlling worry, and having trouble concentrating. People have reported experience a sense of impending danger and panic.
If you or someone you know experiences any of these symptoms, you can seek help from a primary care provider or a mental health specialist, such as a psychologist or a psychiatrist. A psychiatrist specializes in diagnosing and treating mental health conditions, whereas a psychologist provides counseling, which is known as psychotherapy. During the diagnosis, your medical provider will do a psychological evaluation to discuss thoughts, feelings, and behaviors.
During your visit, your doctor could speak to you about various treatments. According to the Cleveland Clinic, one option includes a combination of medication and psychotherapy. This would consist of antidepressants, which are medications that adjust how your brain uses certain chemicals to improve mood and reduce stress. Benzodiazepines can be used to decrease anxiety, panic, and worry. Another medication that could be used is beta blockers, which can help reduce physical symptoms such as rapid heartbeat and trembling. The psychotherapy part of the treatment can include cognitive behavioral therapy, or CBT. CBT teaches you to recognize patterns and behaviors that lead to anxiety.
Many people are affected by stress and anxiety every day. According to Better Health, an anxiety disorder may lead to social isolation and clinical depression and can impair a person's ability to work, study, and do routine activities. It may also hurt relationships with friends, families, and colleagues. We have been speaking a lot about what anxiety is and the various ways you can seek help. Another central factor of this topic that we need to discuss is what we can do to cope with these anxious feelings on a daily basis.
Some ways to manage anxiety could be taking deep breaths, stretching, meditating, and journaling. The CDC also recommends that you find people you trust to share what you're feeling. This can help you feel supportive when you're feeling anxious. Another lifestyle change that could help is making sure that you're getting enough sleep. The recommended amount of sleep in adults is 7 or more hours. It is also vital to prioritize physical fitness and make sure that you are staying active, whether it's by going to the gym or going for a walk. Eating a balanced and healthy diet can also help you cope with stress and anxiety. Implementing these small daily habits can help you take back control and live a more intentional, balanced, and fulfilling life. Thank you for taking the time to tune in for our second episode. We will be waiting for you next week to discuss the topic of schizophrenia.
From symptoms to solutions, this has been the Health Diagnostic. Until next time, stay well, stay informed, and stay empowered.